I guess we're all ready to go. The cameras are ready, and I'm ready, and everybody's seated. First of all, I want to welcome all of you here this summer. It's winter has been a rotten one, as far as I'm concerned. I don't know Carol; she likes winter, so anyway. We hope that now we're into March, we can get rid of all the ice first. For your information, we have definite speakers for the months of April and May. And before we put on today's speakers, I'm just going to go over the ones that we have for April and May. The April 1st meeting, we will have the members of the Plymouth County District Attorney's Office with Tim Cruz and the girls. They're going to be taking the program, and it's going to be on CPR. So they will be here doing that program for us on CPR. The May 6th one meeting will be run by Plymouth County District Attorney Tim Cruz. He's going to be doing that program, not me, so that will be his whole program with the girls from the Plymouth County District Attorney too. And it's going to be the Comfort Dogs. Tim Cruz is the originator of the Comfort Dog, origination of Plymouth County. So he said he'd be glad to give us the whole story of how it started and who was involved with it. So Tim Cruz will be doing that program. And at the meeting, the next meeting will be June and July, which I'm working on people for that. Next meeting we have, I can let you know who will be the June and July speakers. Today we're going to have the SMP to speak, and the senior Medicare program, ProTro, I guess that's what they call it. Dennis, is that the right definition? Okay. Okay, this senior program projects and receive grants from ACL, which he will explain that, to recruit and train retired professionals and other adults and community members to prevent, detect, and report healthcare fraud, errors, and abuse. These SMP team members participate in outreach events to help educate Medicare and Medicaid. So we'll introduce Dennis. Dennis is here, and Laurie. So both of these people are going to do the program, and you can start right now and do your thing. Okay?
Thank you very much.
So
my name is Dennis.
Welcome, Dennis and Laurie.
Dennis and Laurie. So my name is Dennis Hohengasser. I live in Taunton. I've been a volunteer with a group called Senior Medicare Patrol for about 7 years. My background, I worked for the state for 33 years in training and staff development, and when volunteer opportunities came up, this seemed to be something I could probably do. Laurie's with me. Laurie's a staff member with Senior Medicare Patrol up in Lawrence. We'll talk about a little bit who we are and what we do as we go through the presentation. How many people are on Medicare? See, my mother told me you should never ask anybody how old they are, but now I got a general idea here. Let me take out this, because we need this. Before I begin, I have some questions I want to ask you. First of all, how many people have their Medicare card with them? Okay. How many people have their Social Security card with them? Okay. Have you ever taken a look at your Medicare summary notice that you probably get every 3 months if you get them in paper, or you get an explanation in banner? How many people take a look at those? Good. How many people have an Advantage plan? People are looking around, what's an Advantage? Well, we'll talk about those too. Have you ever had a telehealth visit with the doctor over the phone or in front of the computer with some kind of app? Good. Some people have, some people haven't. Have you ever requested a new Medicare card? Prior to the new Medicare cards coming out about 4 years ago now, what was your Medicare number? Social Security number, and that's something you can't change unless you're probably in witness protection. But you can't change that. With the new Medicare cards, now it's an 11-character alphanumeric. And if you think your card has been compromised and somebody's using your number, there's a way of requesting a new card now. How many people are caregivers? Some people have been in the past. Does anyone know anyone who's been a victim of fraud? Has anyone been a victim of fraud? Me. So we're going to talk about a couple things today. Who the Senior Medicare Patrol is, who we are and what we do, the differences between fraud, errors, and abuse, how to protect, detect, and report fraud, errors, and abuse. I gave you something called a personal health care tracker, and we're going to talk about what that is and why we think it's important to use and the benefits. And then we'll talk about additional resources. So the Senior Medicare Patrol, Lori being a staff member, she is based out of Lawrence at Age Span up there. And we do a couple of things. Well, actually, Senior Medicare Patrol exists in all 50 states and the 4 territories. Again, we're based up in Lawrence, and we do take care of all of Massachusetts. We do a couple of things. First of all, we come out and do presentations like this to inform beneficiaries about their rights and responsibilities when it comes to Medicare. We also do claims resolution. If you have a problem with a bill that comes in and you're not sure it's really yours or there might be something wrong with it, a great place to start is to call Senior Medicare Patrol, and we'll talk about the phone numbers in the back of the book a little bit later, but ours is the first one there. So if you have any problems, you just don't understand a claim coming in, you're not sure if you should pay it or if it was denied, we'll talk about that too. But the Senior Medicare Patrol can lead you through what you should do next. And we also do tabling events. If you have a health fair, we will come in and set up a table and share information on, on Senior Medicare Patrol and on Medicare. So what we do as a program, we empower and assist Medicare beneficiaries, their family members, caregivers to prevent, detect, and report fraud, errors, and abuse. And again, we help claims resolution. So what is Medicare fraud? Fraud is intentional. There is no mistake about it. These are professional criminals or unscrupulous providers who are billing Medicare for services that were never provided. It's a crime. And the Medicare budget is well over $600 billion a year. It is a ton of money. 10%, $60 billion, goes to fraud. And we are not talking about beneficiaries perpetrating the fraud. We are the victims as well as the system. We, in fact, are the first line of defense to keep Medicare safe for ourselves going forward and people coming after us, people who are turning 65 in the next years coming ahead. So fraud is always intentional. There is no mistake. As a matter of fact, there was an article in the Boston Globe last week. This durable medical equipment provider up in Stoughton has been accused of bilking Medicare for $30 billion. And we'll talk about why these things happen as we go through. So, fraud is intentional. No mistake about it. They're ripping the system off. Errors and abuse are a little different. Errors are unintentional. When you go to the doctor now, if you're talking to the doctor, what are they doing all the time you're there? Well, checking you, of course, but yeah. On their computer, click, 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 click. If they click the wrong thing, they may click a wrong procedure code, which now means Medicare is being billed for a service that wasn't provided to you. And the other thing is it now becomes part of your electronic health care record. You do not want bad information on your record, on your health care record. So they're unintentional, they happen, and they can be fixed by calling the provider, and we'll talk about some of the ways to correct these things as we go through. Abuse isn't really errors, and it's not really fraud. It's sort of in that gray area. They're pushing the envelope a little bit. And it involves wrongly or improperly performing tests and or procedures that are not consistent with sound medical, physical, or billing practices. It's not quite fraud, and it's certainly not errors, but it's in between. But it's something we need to watch out for. And I've got some examples of that as we go through. In either case, it can result in payments to Medicare for services that weren't provided or provided unnecessarily. And it can also result in co-pays and deductibles. That affects you directly, too. So what are the top fraud schemes out there for Medicare? First of all, billing for services that were never provided. A couple of years ago, I did a presentation down in Dartmouth, and we got talking about the explanation of benefits. And one woman says, oh yeah, she says, I got those. She says, they came in the mail, I looked at mine, looked at my husband's looked good, mine looked good, but I'm looking at my husband and says, he was inpatient in the hospital for 3 days. In Florida. She says, we've never been to Florida. So what happened? So either the wrong number got put in there and it was billed to him or on his health record, or somebody got a hold of his number and is just bilking the system. It wasn't a mistake, it was fraud. It could be either or, but it needs to be reported, and we'll talk about that. Home health care is another one. Has anyone ever had home health care? Okay, some people have. Home health care is another area where we see scams going on. These can happen when your doctor prescribes 12 visits from home health care. And it's important if they prescribe 12, you keep track of the 12, when they came and what they did and who came. If all of a sudden you're looking at your statement and it says 14 visits, well, they're billing for more services than you were actually prescribed for you, or they actually came to the house. So we see people billing for more services than were actually provided. X-rays, wrong body parts or unnecessary X-rays, we see that happening. Drug diversion or incorrect medication or the wrong amounts. I have a friend, when they get the pills from the pharmacy, they take them out and count them to make sure. We also see that we know there's an opioid crisis across the country. This oftentimes happens in skilled nursing facilities or rehab. If you are in there and you need pain meds, usually an opioid, and you're required to get four doses a day, how do you know you're supposed to get 4? If I was there, I wouldn't pick up the chart and start to read it. I wouldn't know what I'm reading. But what happens is that somebody is prescribed 4 and you're only getting 2. What's happening to the other 2 doses? Upcoding is another one. Upcoding is billing for a higher service than was actually performed. One example, if you go to have an MRI, there's 2 types, one with a dye and one without. What's more expensive? With the dye. So it's important to look at your Medicare summary notice to make sure that you're being billed for a service that you received. People will say, well, how do I know it was with the dye? Why? Because they're going to stick a needle in you to get the dye into you. That's why. The other thing about upcoding, this was an article I read I'm from Western Mass originally, from years ago, and so I keep track of the Greenfield Recorder Gazette newspaper. And there was an article the other day that said that Regal Care, which operates skilled nursing facilities and rehab facilities in Massachusetts and Connecticut, 19 of them, they are being investigated for billing $3.8 million for higher services than were actually needed or even being provided for in a skilled nursing or rehab facility. So it's important that we always are aware of this kind of stuff. Unbundling, this happens with labs. When you go to a lab, and this is for anybody, it doesn't make any difference if you're on Medicare or not. When you go to a lab and they run a panel, they blood test, they run a panel, And the panel checks for what, 5 or 6 things: your cholesterol, your blood sugar, kidney function, liver function, and 2 others, whatever they are. So they bill as a panel. It's one entity, one charge. When they unbundle, they charge for the sugar separately, the cholesterol separately, the liver function separately, and added together, it becomes a whole bunch more than just the cost of a panel. Identity theft and medical identity theft. If you have a problem with your credit card and you see a charge on that isn't yours, what do? You call the credit card company, and what do? They take it off, usually, they take it off, we'll do the research, and we'll take care of it. Nothing happens. I mean, nothing happens to you. Medical identity theft is a little different. If somebody gets a hold of your Medicare number and starts to bill Medicare for services you didn't receive, 2 things happen. 1, it becomes part of your health care record, which shouldn't be there. And number 2, if there's co-pays or deductibles, guess who's responsible for those? You are. You can't call Medicare and say, gee, someone got a hold of my number, can you take it? No, it doesn't work quite that way. It isn't quite as easy as dealing with a credit card, someone stealing your credit card number and billing. So be very careful about medical identity theft. That's why we're going to talk about our Medicare cards in a minute. False front providers. This can happen in a couple of ways. You have this pain or problem, you think, I wonder what this is. So now the internet is available to everybody, and you go on to WebMD or Google, and you Google your symptoms, and bingo, and up comes a list of all the things you can do. Oftentimes in these, there's probably a link to somebody who can help you. And before you know it, you're clicking on a link and you're giving personal information out, either personal or your Medicare number. So be careful about Googling anything when you're doing searches for, trust your physicians. So Googling is one. The other one is false front providers, is getting a call. Getting a call and saying, we can help you out with your problem. We know that you have, I mean, how many people are diabetic across this country? You get a call out of the blue about, oh, we can help you with your diabetic supplies. Yeah, we'd like to all think we're special, but we're not so special. People are beating a path to our door to give us all kinds of free stuff. They just aren't. So be careful when you get a phone call. The other thing is, when you get a phone call and you don't know who it's from, what should you do? Not answer. Because think about, as you're growing up, as we're all growing up as kids, when you left the house, what did your parents say? Don't talk to... Who's at the end of the phone? Yeah. The other thing is getting emails or text messages saying that there's a, quote, problem with your Medicare card or your account. All you need to do is click on this link. You should never do that. So they're coming at us, these false front providers, in a number of different ways. Durable medical equipment. You probably think that this box right here has a whole bunch of free gifts for everybody in the group. The only free gifts you're getting are coffee and donuts over here. Let me put this in my pocket and let me put it over here because I don't want to click it. Durable medical equipment. This box I picked up in Mansfield. A woman in Mansfield brought this into the senior center and said, I got this in the mail, I never ordered it. She says, would you think anybody here could use it? One leg brace, 2 leg braces, a couple arm splints, and a back brace. It all came to her. She never ordered it. Medicare was billed over $3,000 for this. So somebody got a hold of her number and started to bill Medicare. I mean, you can't bring this to the senior center and say, does anyone need it? These devices have to be prescribed by a doctor. One leg brace is not the same as the other. No, different problems require different braces. So you need to be careful with your Medicare number so that nobody gets a hold of it and starts billing Medicare. I did a presentation in Taunton just before Thanksgiving. And we got talking about this, and two people said to me, oh yeah, I checked my Medicare summary notice, and I was billed for Medicare was billed for $3,000 for catheter supplies. I don't need catheters. And two people got that, and another guy said, same thing, he just got out of the hospital several weeks before, and he had some kind of knee surgery, and what came in the mail? Boxes of braces. And when these boxes of braces are sent, they're not sent as a brace like you see here. They're what we call mummy kits. You put them on all your parts, and you look like a mummy walking around. Be careful. Let me get my clicker again. And the other one is scams for genetic testing. The only one that can prescribe a genetic test is your physician, and they don't do it on a regular basis. You can't go to a health fair and have a table set up and someone saying, oh, do you have a problem with, and fill in the blank, well, you can get a genetic test and Medicare will pay for it. Just fill out this information. First of all, you're giving personal information out to someone you really don't know. The fact is, you're never going to get a test kit. But what they have now is what? Your Medicare number. Like I said, durable and medical equipment, this is one of the biggest ripoffs we see, whether it be braces, with oxygen, catheters. What else are we seeing up that Carol works on?
Mostly the durable medical equipment, the bracelets and catheters are huge.
And it's thousands of dollars they bill for these. We have a quick story. Rita Vines she lived up in Haverhill. She had a 10-year-old scooter chair because she was diabetic and she really couldn't get around. The seat was torn, but she needed a new battery, and she knew that Medicare would pay for a new battery. Before she could call Medicare, her friend from downstairs comes up, Rita, look at this brochure I got in the mail. You could get a brand new scooter chair and Medicare is going to pay for it. This sounded like a good deal to Rita. So she ordered it, and it came. They upsold her to the Rolls-Royce version. It was too big to get comfortably down her corridors. She bumped into some door casings. She broke some toes. This was not working. So she called the provider and said, I need to get another one. Reluctantly, they took it back, and they gave her another one. This one she could not get from the scooter to her bed or scooter to her easy chair very well. This was not working. So she threw up her hands. She called Medicare, and they wouldn't take it back. So she called Medicare and said, I need a new battery for my chair. They said, ma'am, we just bought you a $4,000 new scooter chair. We're not going to do a battery. And it took the folks, she called Senior Medicare Patrol, and it took the folks at Senior Medicare Patrol about 8 months to work through the process. And the people that help do claims resolution are people who have health insurance backgrounds and some medical background. On her own, I don't think Rita would have been able to solve the problem on her own. We use this graphic because Medicare can be a puzzle. There's two types of Medicare: traditional Medicare, or sometimes called original Medicare, and something called Medicare Advantage plans. About 50% of all beneficiaries are on traditional Medicare. That's what I chose. And the other 50% are in Advantage plans. I can't tell you which is better for you. I know who can give you information to help you make an informed decision. Does anyone know who that might be? Shine, exactly. The Shine counselor right here in Halifax. They can tell you what the options are. They'll never tell you what to do, but they're going to give you all the options so you can make an informed decision. So, traditional Medicare, A is called A, which people say, well, we get that for free. No, we don't get it for free. We paid for it all of our working lives, so we don't pay for it now. So Part A. Part B, people pay, if they opt for Part B, it's about $180-something a month now. And then Part D, which is the prescription drug plan, which is private health insurance. So federal, private. And then we have the Advantage plan, which is all private health insurance. As with all private health insurance, one of their biggest concerns is for their investors. How do they make money? And that's what their job is, to make money, to keep people healthy, but to make money. That is not what This does. The only problem I have with the Advantage plans is their marketing. You've seen it on TV. The woman comes into the doctor's office and said, "Oh, I'm here for my annual checkup, and I'm on Medicare now." "Oh, let me see your card," she says. "Oh, I see you have traditional Part A and Part B, but you don't have Part C," at which point I just want to scream. No, Part C is not an add-on. You have this or you have this, but you cannot have both. And it just sends me right over the edge. I think it's unfair marketing. You don't get Part C automatically. No, you don't get Part B automatically. You have to apply for Part B. So their marketing really kind of sends me a little bit crazy. You could tell. So let's do some comparison. So we have original Medicare here, and we had Advantage plans here. Original Medicare, it does have higher monthly premiums, as opposed to Medicare Advantage plans, which have lower premiums. So some of it is cost related. But also with lower premiums, they share the cost with you. Sometimes it's higher deductibles, higher co-pays, and higher co-insurance. So there's trade-offs for both of those. As a original Medicare beneficiary, I don't need to get a referral to go to a specialist. You do, though, under Medicare Advantage plans, and you have to wait for them to decide if it's going to be okay. The other thing is, I can go to any provider anywhere across this country to get, as long as they accept Medicare, I can go to any provider anywhere. Under a Medicare Advantage plan, you're restricted. If it's an HMO, you can only go to, when they listen to their ads, call to see what's available in your area or your zip code. Which means if you have a doctor in Boston and you're living down here and that's a cardiologist you see on a regular basis, you'd want to make sure that that cardiologist is part of this, whichever Advantage plan you're going with, because you were restricted. The other thing is, there are some Advantage plans that you can go to doctors outside your area. They're not as common as the ones where you are restricted. For instance, if you were a snowbird going to Florida, and you have an Advantage plan, and all your doctors are up here, and you get sick down there, guess who pays the bill down there? You do. Unless it's coded as an emergency, and then they will pay everything to get you out of that emergency situation. Going forward after that, it's up to you. So I talked about referrals. Non-Medicare services and skilled nursing facilities may not be covered under traditional Medicare, and they may be included in some. We also hear with the Advantage plans dental, vision, and hearing. So that's one benefit that they have. And like I said, covered anywhere versus coverage only in your area. So Part A under Medicare pays for inpatient hospital, skilled nursing facilities, hospice care, home health care for the homebound beneficiary. So you have to be homebound. And it pays pretty much 100%. Part B, and that's where most of the charges on a regular basis come under, Part B, pays for doctors, outpatient care, home health care, physician, physical therapy, occupational therapy, and this whole thing called durable medical equipment, braces, crutches, everything. But it only pays how much? 80%. So if the bill is $1,000, Medicare is going to pay $800, you're going to pay $200. And then you need also Part D for a prescription drug plan. This is private. It's offered by lots of different companies, but you need 3. And what happens with Part B? A friend of mine gets most of his care through the VA, and applied for Medicare, turned 65, But well, I get most of my stuff at the VA, so I'm not going to apply for Part B. A couple of years afterwards, if we're traveling around and there's not a VA facility nearby and I need care, I probably should have Part B. So bought Part B 3 years afterwards. If you delay your purchase of Part B, you start paying a premium every month. So he is not paying $183, he's paying $204 every month forever. The same thing happens with prescription drugs. If you choose, person says, well, I'm on Medicare now, but I don't take any drugs. Fine. If you want to delay purchasing it, if you wait, the longer you wait, the larger the penalty is. Once you finally decide, oh God, now look at the prescription drugs I need. And then as I said, so we have A, B, and then we have C. Remember, you notice how none of these, C is not attached to anything because C is separate. It is it's private health insurance. So as beneficiaries, there's 3 things we can do. We can protect, we can detect, and we can report. To protect, we need to protect our Medicare cards. I asked how many people have their Medicare card with them. You should not carry it on a regular basis. There is no need to. If you lose your wallet and someone gets a hold of that, they can start stealing your medical identity. You should only carry it when you go to a doctor, specifically a new doctor. I get the notifications all the time saying, your appointment is scheduled for next week, make sure you bring all your medical cards with you. I don't, because this is a doctor I see on a regular basis. With the first time you go to a doctor, what do they want? 2 pieces of information. What are they? Your healthcare cards and photo ID, to make sure that face goes with that name and that card. And what do they do with it? They scan it in. So that when you check in, they call up your name, and there's your picture, there's all your health insurance. So you do not need to carry it on a regular basis. Social Security cards, you should lock that away and never take them out. There is absolutely no reason. That is a carte blanche to any scammer, not just Medicare, but any scammer. You should never, ever carry your Social Security card with you. And of course, we're safe with our credit cards. As I mentioned before, don't talk to strangers. And that's who at the end of these phone calls. And be careful of postcards you get in the mail, deceptive TV ads, phone calls, and questionable surveys. Every 6 months, I get this large envelope in the mail, and it says something about Medicare and survey. It's not coming from Medicare. Medicare doesn't do that. They want you to answer a whole bunch of questions. I have no idea who these people are. I have no idea where this information is going, so do not complete surveys when it's something that you have no idea. It sounds like it's Medicare. It isn't. So how do you currently keep track of all your medical appointments and your prescriptions and those types of things? Calendar. Anything else? Does anyone use a portal? Okay, some people use a portal. There's a couple things. I gave you something called a healthcare tracker. And let me take a look at that let's all take a look at that for a minute. We think this is a neat tool for a couple reasons. First of all, before you go to I can't tell you how many times I've been before using this, went to the doctor and left saying, oh God, I wish I had asked, fill in the blank. Or leaving the doctor saying, did they say this or did they say that? And it requires either another call back and waiting. So this is one place you can keep all information. For instance, there's a section where you can write your appointment lists. The doctor that you saw, the date that you saw them, what you saw them for, and a place that you can put in all the questions before you get there. And also, space there that you can write the responses. What did the doctor say? Yeah, sometimes they give you a printout at the end, but that doesn't sometimes answer the questions that you have right on your tip of your tongue. So it's a great way of keeping all this keeping each visit in one place. The other thing is, when you get your Medicare summary notice, I mean, I can't remember what I had for breakfast except when somebody brought in donuts this morning. But I can't remember what I had for breakfast. I'm not going to remember what happened 2 months ago or 3 months ago at the doctor unless I have it written down somewhere and can compare it to my Medicare summary notice. So it's a great place to keep all that information in one place. You can also put in all your medications here, any care plan you have on a regular basis. If you're a diabetic and need insulin, that should be in here. If you had a pacemaker, that should be in here. So all your information is in one place. If you would take a look for a minute at page 10. I think that's the next slide here. Yes. Before you and this isn't just for Medicare beneficiaries, this is for anybody who's going to see a doctor, anybody. Here are 5 questions that you should ask before you have any test, treatment, or procedure. First of all, do I really need this test or procedure? We make the assumption, well, if I didn't need it, they wouldn't prescribe it. Ask them. Doctors like to have engaged healthcare consumers. Ask these questions. Why do I really need this? What's it going to show? Number 2, what are the risks or the side effects? What are the risks and side effects of having any test or procedure? We assume that everything they tell us that they're going to do is going to be safe. There's oftentimes side effects. Are there simpler and safer options? So what are my choices? What happens if I don't do anything, or if I do nothing, or if I don't do anything? That happened to me. God, my ankle, did it hurt? Oh, for weeks it hurt, to the point where I started to limp a little bit. So I figured I'd go to the bone guy. And he looked it over and felt it around. Well, I can do a couple things. He says, I can give you a shot. So that clears it up. He says, we can take some x-rays or MRIs and see what's going on. Or we can do nothing. What did I choose? I didn't do anything. And within 4 weeks, I was back. I don't know what the problem was, but it cleared it up. I did not opt for some kind of intervention. And the last one is, how much did it cost, and will my insurance pay for it? The doctor may not know, but the front desk will. Another story from me. My GP was on maternity leave. I went in for my annual checkup, and the nurse practitioner is looking over everything. Gosh, she says, you're due for a pneumonia shot. She's looking at my records. You need a pneumonia shot. Stick it in. And they did. She did. And 4 weeks later, I get a bill for $475. So I worked with the doctor's office, they resubmitted it, worked for the Group Insurance Commission and Medicare. Come to find out, did you know that you were only allowed so many pneumonia shots in a given period of time? One or two things happened. Either she read my chart wrong, or when they converted my paper charts into electronic, something got in there wrong. So I argued the point with them. They admitted it was their mistake, and they dropped the charges. But you need to, if you don't think these charges are yours, you need to fight them. So to detect, you should take this every time you go to the doctor, write down the questions, write down the answers, keep all your medical information in one place, carry it with you when you travel, especially if you're going to be away from home. I think that they just left us and they think that's where they're going. I don't know where, but you should take this and compare all your doctor's appointments that you write in here with your Medicare summary notice or explanation of benefits. So you're not being billed, or Medicare's not being billed, and you're not having stuff on your in your health record that isn't for you. And they say we should keep our statements for 3 years. If you have a problem, it can take a long time to resolve it. Now, one of the things, when I was younger, much younger, an older friend of mine would say, I keep on getting these things. I don't understand these. It says it's not a bill. Why should I be concerned? Well, they should be concerned for a couple reasons. So and if you see a doctor lots of times within a 3-month period, you can get a stack of papers in the mail, all these claims. But if you break them up by visit, they're not that complicated. First of all, you want to make sure that this is your name and your address, and that is your Medicare number. That's all you need to look on this page. The second page is looking at the exact claim. Let's blow that up. Okay, so this actually is mine. Back, almost a little over 2 years ago, I had cataract surgery in January here, February here, and then the 3rd month I went in and they took a picture of my eyes to see how everything looks. You got some fluid in the back of that eye, they said. We need to take care of that. How? Well, we could give you pills, or we could give you injections into your eye. What did I say? I said pills, but she convinced me that the best way was to do injections, and it's not that big of a deal. They numb it up so you can't feel anything. So this is one of the claims that came in. When you look at these forms, you want to look at the date. Is this the date that you saw the doctor? Is this the doctor or provider that you saw? iHealth Associates. I saw Dr. Elise Richards, and I had an injection. The injection is here. The first thing you want to look at is, was the service approved? That's critical. If it says no, then you may be on the hook for it, and we'll talk about how you can dispute that. But first of all, was it approved? In this case, the shot and her service was. You don't even need to look at this column. It doesn't make any difference. How much did they charge? It doesn't matter. These are negotiated costs. They know exactly what they're going to get paid. This is what you would pay if you didn't have health insurance. In this case, that medication for one shot was $6,510. I almost fell off my chair when I saw that. Of which Medicare only approved $21.65. That didn't come as a surprise. She knew what she was going to get. Medicare only paid out of the $21.65 $1,509, which is about 80%, because it's a Part B service, which left me paying $625 for each of those shots. I've had 6 of them. But I also have purchased, when I worked for the state, when I retired, I got Part A and Part B, and I bought a Medicare supplement, or they're supplements, or sometimes they're called a Medigap policy. They're not that cheap, but it's something I needed to do. And because of that, I didn't pay anything. So when you look at these, was it approved? Ignore this. How much did Medicare amount approve? How much did they pay? And is there anything left for you to pay? So it's not all that complicated. If you have a whole stack of these, break them down by visit and take a look at those.
Dennis, do you think these what we need to save for 3 years?
Do I need to save these for 3 years? That's what they say. I get mine electronically. There's 2 ways of receiving your Medicare summary notices. I have my Medicare account, so I get them every single month electronically, so I don't need to save paper. If you don't have one, if you don't have a My Medicare and you don't get your explanation of benefits or Medicare summary notices monthly, then you get them every 3 months, and that can be a lot of paper sometime. So, and consider what Part B covers. Most of what we receive is Part B, doctor's visits and lab tests and those things. Even a friend of mine is going to have his gallbladder removed. It's day surgery outpatient. Outpatient is Part B. So it's amazing how much stuff is under Part B. I mentioned if Medicare said they are not paying for it, then you have a right to appeal. You have 120 days to appeal the fact that they denied the claim. If you're not sure of how to do this, call the Senior Medicare Patrol. We can help you work through the process. So folks who are on an Advantage plan don't get this thing called a Medicare Summary Notice, MSN. What they do get is an explanation of benefits. And it could be Aetna, Blue Cross, Cigna, Humanitas, United Health. There's a whole bunch out there. Remember, just because you have an Advantage plan, say with Blue Cross, and you have an Advantage plan with United Health, doesn't mean they cover the same thing. Not all Advantage plans are the same. They differ. They're all negotiated separately. So if you're going to get an Advantage plan, you need to do your research. Exactly what is covered. Which medications are covered? Because some of them have restrictions as to which prescription drugs they will cover. So it's important to be informed and do your research. And some folks will say, well, maybe, you know, this traditional Medicare, it's getting kind of expensive. Maybe I'll look at an Advantage plan. Great, look at the Advantage plan, but do your research to know what is covered and what isn't covered. So report. If you think there's a problem, report it. Call the Senior Medicare Patrol. I mentioned home health care. I've done so many of these presentations, and I hear oftentimes, oh yeah, I had home health care, but after the second visit, the service was terrible. I didn't want them back in my house. So what do? Well, you need to report it. And this is one group you can report it to. It's in the, oh, let me go back to this booklet for a minute. Take a look at the very last pages, the last 2 pages. There are phone numbers. If you have any problem, of course, Senior Medicare Patrol is a great place to start, but there are numbers for everybody that you would ever need to contact relative to having a problem with Medicare. From Elder Services to Medicare, 1-800-Medicare. But there's one over on this page here, second from the bottom, first column, and it's called KeyPro, but they changed their names. They're now called Accentra. Same phone number. If you think you have received poor service from, say, home health care, report it. The chances are, if you're getting poor service, you're not the only one. This could be a pattern. If you also have been, if you think you were discharged from a hospital or skilled nursing facility too soon, you want to let somebody know, and you can call this number. They report all this stuff to the Office of the Inspector General. I don't know if they exist anymore. They may have been cut with this latest round of whatever. But you need to call this number to have it reported. Because if people don't report, then nobody knows. So the steps that we can do to report it, one, call the provider like I did with my pneumonia shot. Call 1-800-Medicare. You can call the Senior Medicare Patrol. Again, all these numbers you don't need to write down because they're all in the book. So why don't people report? Why don't people report that there's fraud and abuse going on? First of all, it's not impacting their pocketbook. Well, there was no copay, no deductible, so I'm not going to let it ride. It's important that you tell somebody, because you are not the only person probably experiencing this. And out of pocketbook, your health care premiums for an Advantage plan or with Part B will go up. I don't want to bother the doctor. Do what I did, bother the doctor. You find the MSN or EOB kind of confusing. I hope that little demonstration clears it up a little bit. You're part of a minority community based on race, ethnicity, religion, country of origin, sexual orientation, and language, and you're just uncomfortable asking for help. Some cultures, people just don't ask for help, or they're uncomfortable asking for help. Sometimes they don't even know what questions to ask. And you probably think, again, I'm the only one having this problem. No, chances are that's not happening. So trust your gut. If something doesn't feel right, it probably isn't. I do a lot of work with AARP on fraud, and we have two things. If it sounds too good to be true, it is. If it sounds too bad to be true, it probably is. I'm sorry, we're going to cut off your Medicare because you didn't fill out certain forms. I'm sorry, you didn't fill out the survey. Your Medicare benefits are going to be terminated. If it sounds too bad to be true, it probably is. Seniors are great at this. Oh, I got the bill, I better pay it right away. Get the check in the mail. If you're not 1,000% sure that it is your responsibility, don't pay it. Will you get the money back if you paid in error? Eventually, but it's going to take some time. So, in wrapping up, a couple things. Don't carry a Medicare card with you. Don't provide your Medicare number over the phone or to anyone you do not know and trust. Keep a record of all Medicare events. Review your MSN or EOBs to make sure that all the stuff there is correct and that there's no bogus information on your health care record. And take action if something is wrong. And there's our number. That's all on the thing. Did anyone notice all these slides, what's on the left side of that, the picture on the left side of all these slides? The key. Because as beneficiaries, we hold the key to keeping Medicare safe moving forward for ourselves and for our kids coming along. Questions?
If everybody, if anyone wants to ask questions, I have the microphone here, and according to the cameras, they may not hear if you do it by yourself. So if you have questions, I'll bring the mic over to you.
You mentioned about not bringing your cards to the doctor's office. But even doctors I've seen repeatedly still ask for them. Do you just tell them no?
I'm not sure why they're asking if they have them already. I would know what I would do. Oh, don't you have that scanned in yet? Ask them. I've never been asked to a doctor I see on a repeated visit to ever, but. Oh, right. They may be updating their records, sure. So if you're going to the doctor, but you shouldn't carry them on a regular basis if you're going to the doctor. You know, one of the things I hear people say to me, yeah, but what if I'm out and I'm in an accident and they bring me to the hospital and I don't have my cards with me? What's going to happen? I don't know, you're going to die probably. No, of course not. What is their primary concern? To address the emergency and get you stable. Their first concern isn't where are your Medicare cards. As a matter of fact, any hospital or larger facilities and sometimes doctor's offices, if you were to give them your social security number, guess what they could look up? Your Medicare number. So I understand that, yes, if they're updating their records, and sometimes they change from one billing system to another, and they may want to scan them in again. Yeah, so, yeah. But so if you're going to a doctor, bring them. But on a regular basis, you should not carry them. But thank you for that question. Yeah. So when you go to the doctor, bring them. But you shouldn't carry them as a regular. And when you go there, if you don't have them, they're not going to deny you.
They won't throw me out.
No, they won't throw it. No. They usually say, bring them next time you come in. Any other questions?
I saw that.
The ambulances. Oh, God. Ambulances. Yes. Ambulances and ambulance transport. If you go to have blood work done, and they run a panel, you can go anywhere across this country or across the state here, and it's always the same. Ambulances aren't the same. Every transport is almost an entity unto itself, depending on who the provider is. Is it local? Is it, say, a town ambulance versus someone they contract with? I did a presentation in New Bedford. This woman says, oh yeah, she says, I have an Advantage plan, and I needed an ambulance. They came to the house, put me on the stretcher, took me out, and before they put me in the ambulance, the EMT said, we need a $300 copay first before we take you. You are putting me in that ambulance now, she said. It's important, especially if to do some research. God forbid we need an ambulance. And when we need an ambulance, how we're going to pay for it usually isn't our biggest concern at that point. But be aware that ambulance transports can be billed differently. As a matter of fact, this pamphlet was put together by SMP up in Lawrence, and I was in the task force that helped work on that. And Dennis Cataldo was part of that. Dennis Cataldo is the president of the Massachusetts Ambulance Association and also owns Cataldo Ambulance. And some of the stories he was telling us of horror shows with ambulance transports, it can be, thousands of dollars to go 3 miles. It really is important that we ask questions. Again, if you need an ambulance right now, that isn't probably right in the top of your head about, is going to pay for it. We just assume it's going to pay. But just don't pay the bill carte blanche, and do your research before you pay the bill. Yeah, ambulances are it's a big topic, yes.
It's so because of the diversity of how it pays,
Exactly, yes. Yeah.
I remember we were doing that research.
Oh, why don't you?
I remember, because I remember Dennis. Dennis has been doing this for a long time, and I am so appreciative that you were able to come out today and do this. But I started back off in the Shine world back in 2000. When
I should give you a hug for being a counselor.
I didn't pretend. I just thought it would be fun. And it was a great opportunity to meet the senior Medicare Patrol people. At that time, they were separate from the age wave or the age span, and now they've expanded, so it means that it's such an important part of our lives, and as we age, we're an aging community no matter what. It's so important to understand all aspects of what we're going to encounter at some point. Some of us are already there and in the midst of it, but October 15th to December 7th, that's the open enrollment period. So sometimes it's good to store all this information either in a file or up here. But to remember that time comes and you can change, but you have to adapt to what's going on in your life at the time. So whatever fits yesterday may not fit today. So it's always good to change, and even especially with the medications situations today. Every pharmacy, I can go into a long story on that, that's another topic, but the benefit managers, they don't always pass that discount off to the consumer, and we end up paying for that. So we're hoping that sometimes in the future we'll be able to change some of these things that are happening to us as consumers, and I'm hoping that, especially with medications today, when a drug, especially for diabetes, and it's very expensive for people that do have diabetes, and trying to control that with, the various medications out there. So we're hoping that we can work in it. You guys are doing a wonderful job, Lucia. She's an amazing woman, and Lucia, I call her Titia, but she's Portuguese. So, but anyway, she's been a wonderful asset to us, and Shine program, of course, and I thank you. Yeah.
Thank you. Any more questions? I think the coffee's over there now, right?
Okay, Dennis, thank you very much.